So we have another special guest with us. Right now we've got Lacey Prater. Now you're a social worker, but you are with the Journeys program. I know a lot of people don't know what that is, so if you wouldn't mind to just explain it a little bit.
Sure. The Journeys program is our pediatric complex care team. So we serve children who have a life-limiting or life-threatening illness. So once we know that there's something that either we know what that means, like they have an illness that we know about, or they have something that we have a lot of families that is kind of unknown, but that they're at risk for potentially having a complication in childhood, then we follow their family for the remainder of their life. Some of our kids grow up and go into adult care, and some of our kids don't. And you've probably heard a lot of stories of our friends. I love listening to this and getting those perspectives of these kids over many, many years.
And that's one of the beautiful things that we get to experience a little bit from this side of the microphone in 15, 16 years of doing radiothons, to see a Jackson Morton overcome his battle with leukemia, and now he's getting ready to go off to, knock on wood, Georgia or Michigan or wherever he gets to go to, and computers and so many of those stories where for so many days and weeks and months we didn't know if Jackson would be here.
Right. And so our program is really meant to support parents through that roller coaster, right? They get a diagnosis, it's devastating, they don't know what it means. We have some families that their children have ultra rare conditions, and there really isn't even a path forward. We don't know what that will look like, and it's just overwhelming. And they say, like, how am I supposed to make decisions? What do I do? And we can come in and say, like, we work with families who have similar situations. We can help you talk through that. We can just give you support while you figure that out and talk about what's important to your family.
I mean, my own story. Like right now, my daughter has had influenza A late last week, early this week. And you think just with flu, like, okay, well, we got to make sure this, okay, you do this, all these things to keep her safe. To get a diagnosis of a leukemia or a cancer, or like you said, some rare thing that one in a bazillion, the second kid ever in Missouri to be diagnosed with this.
Right.
How do you wrap your mind around the other kids that they have, their jobs, their own health, their parent, everything?
Right. Yeah. Our parents become the head of that team. You know, we have all of these people that you've talked to, the doctors, the respiratory therapists. They have all of these people, but really it comes down to like them keeping everything, figured out. And how do I make that work in my life? We know the system. Well, you have an appointment with this person on this day, that person on that day, and they're like, well, I work and I have other kids. So how do I do that? And so some families will say, like, if there's any way, we live 3 hours away, if we can get these appointments on the same day. And that can be really tricky, but if that's really the biggest thing for them to make it work, we can try to figure out how to do that.
And you guys are there to help. I love the word navigate them through this. You're that beacon of hope, going back to what Tony said earlier, because when it's foggy and dark and scary as all hell, you guys are at least...
Yeah, you want to know somebody's in it with you.
Absolutely. It's a beautiful program, and when they're at their deepest, darkest moments, you guys are right there with a hand to guide and a shoulder to lean on, for sure.
Yeah. And we also provide bereavement support. So I know we have the stories of the kids who don't make it. You guys have the kids that don't come back the next year, and part of what our program's mission is to provide memory items to those families, to provide bereavement support to those families, to make sure that they feel like they still have access to our hospital for support, that doesn't just go away. It's so many people, it's so hard to talk about loss, especially the loss of a child. Like, you want to make people get weird. I tell them what I do, and they're like, I don't want to talk about that. So these families feel really left out, and they know that we're still there to call upon, to ask questions. How do I talk to my other kids? How do we navigate through that situation? We don't disappear from their lives when that happens.
So this is one of those absolutely invaluable services that families get when they come to MU Healthcare's Children's Hospital, and it's something that is not necessarily covered by insurance.
Nope, not at all.
So these are the kinds of programs that are supported by this Radiothon. This is the reason that we do this, because, getting the worst news of your life and then having to navigate it on your own, completely on your own, Nobody deserves to do that. I wouldn't wish that on my worst enemy.
Right, exactly. And, when we think about the things that insurance covers, like they cover somebody to help you navigate who checks all the boxes to make sure you're doing what you're supposed to do. But like when you get into this territory, that's not something that they do. So the fact that our hospital has continued to have our program, supports it when, my services are not billable. Nothing that I do is covered. All of the items that we purchase are bought with CMN funds. It's incredibly special that our community continues to support us in those efforts.
Absolutely. Well, thank you for what you do, and I know the Journeys program is not the easiest to talk about sometimes, but it is so crucial to know, like those families in their worst of times when they had that loss of that miracle son or daughter, that there's still a resource for them to turn to when they don't know where else to go sometimes.
Yeah.
So thank you, Lacey, for what you do at the hospital and for all of those families. Know that resource is there for so many. Pick up that phone and call right now and become a miracle maker. We still need 30 more this next goal that we want to try and hit here. Keep us on pace. Again, we got a little behind yesterday.
Yeah.
And normally we don't kind of share those kind of things, but and because
normally we don't even know those kind of things.
They don't tell us that. We don't want to know those things, but we do want to share that with you, that if you can. A lot of you got paid today. It's Friday, or you're getting paid today. If you can pay it forward and give to these kids, to this hospital, we would love it. 866-970-GIVE. Know that if you text, A1 Containers will match your gift. If you give online, Veterans United will match your gift.
Yeah, you can go to Y107.com. We have a bunch of links up. You can't miss it. You can donate there, or, of course, text the word miracle to 51555, and that'll be matched by A1 Containers.